Hi, Julie. So you're a provider here at Mahaska Health, and what's your specialty? Where do you work?
So I am a physician assistant here at Mahaska Health, working over in the Walk-In Clinic, which is considered part of primary care. But Walk-In Clinic is my only department that I serve here.
All right. So the Walk-In Clinic is kind of like that first line of defense for sick people, and you know, you get sick and you're like, man, I need to see somebody now. That would be
correct. Yes. So we see all variety of illnesses. Mostly during the daytime, it's going to be things like fever, cough, abdominal pain, those sorts of things. Throughout the weekend, which we also serve those hours, and after 5 o'clock, we see everything. So we would see both illness, but also those things that might be considered more with wellness. So, for example, a bladder infection or a skin infection.
Okay. So I understand that there's an easy way for people to actually make an appointment or set an appointment online even. So.
Right. So we developed we actually recently got a new program called Clockwise. And that's been a really nice addition for patients because they're able to go online and select their type of visit. And then they're also able to select a drop-down time of what works best for them. So let's say, right now it's 2:15. They could go online and schedule for a 5:30 appointment if they work until 5 o'clock. Then they either get a text reminder or they just come in 15 minutes before that time and they're seen without having to sit in the waiting room for a time, depending on the day. Could be an hour, could be 2 hours. They also can wait in their car and receive a text when they're ready to be called back next. So that's been a really great addition. Patients have given us a lot of good feedback on that. It's actually helped us too, as far as being able to plan out what our day might look like.
Well, it's another great way of keeping people safe, particularly through the COVID and things like that. So I'm sure that you guys are seeing lots of that. Advice for folks right now. I mean, we have a new variant that's been pushing through the area.
Right, a new variant and a new change in CDC recommendations. So that's been a challenge for us because this new variant is spreading. It definitely is creating higher volumes of COVID positive results. For the most part, people tend to not be quite as ill. Those who are generally healthy tend to move through it a little quicker. But the CDC guideline changed to 5 days of isolation and 5 days of mask wearing now, rather than 10 days of isolation as it used to be.
Okay.
I would say, one of our main goals is to be really open to calling their family practice doctor if there's a question about them, but they're too ill to be up in the family practice world. We also communicate a lot with the ER physicians if we have someone who needs further workup or further care. We've communicated well with the hospitalists. If we have a person who would be better served as a hospital admission, we're able to help with that admission process. We don't necessarily do a lot of referrals to things like physical therapy, but we definitely promote our other departments, such as physical therapy. Obviously, the surgeons are very easy to get a hold of if we need them. The orthopedics department, if we have a fracture or a sprain or strain injury, they're very good about having same-day appointments where we can actually get those people scheduled or talk to that office and they get them scheduled within a day or two. So that's been great.
I was going to say, the efficiency of people being able to come in and see a physician or somebody has greatly increased here, and I think people are noticing that.
Yes, I would agree. Easy follow-up. What Renee was alluding to earlier is if someone is, for example, COVID positive, discharged from the hospital, it's been 3 days and they cannot go to the family practice doctor for hospital follow-up, they can actually have their physician see them down in our walk-in room in that same time frame, but keeping them contained and safe in the COVID area rather than exposing others in family practice. So that's been nice to have the collaboration with the family doctors willing to come see their patients in a department that's not their usual home base.
So, I mean, really, COVID really is the primary leading driver right now for healthcare in the community. I mean, we've talked with several people here about that as far as service providers and physicians and what have you. How are your coworkers? How are you guys doing? I mean, we hear healthcare workers, we're tired. Are you guys doing okay?
Yeah, we're doing okay. Thankfully we have a good team. We've got good support. We've got good supervisors, good leadership that check in on us often. We've also got a good group of family practice providers, physicians and nurse practitioners that are eager to help. And so if we send a message of we're feeling overloaded, can someone come down? There's somebody down within 30 minutes. So same with weekends. We're seeing more and more patients on the weekends, and volumes, there's no capacity. So we see them until the last one leaves. And so it's been nice to have the help from both the family practice doctors, but also the nurse practitioners that we work with. So we've been doing okay. Yes, it's exhausting, but it's our line of work, and this is what we signed up for. So we're hanging in there. We try to keep each other motivated and ask for support when someone needs support. Thankfully we've all remained pretty healthy, and just feel like we're doing our life's work right now.
I was going to say, so when you had the idea to go into healthcare, did you ever envision yourself being a healthcare provider in the middle of such a pandemic?
I'd say no. Couldn't have predicted it 5 years ago, but it is what it is. I've practiced 18 years, so I've worked family practice and specialty, dermatology, cardiology, orthopedics, and so this is where God landed me at this point, and I started in August of 2020 here. And so, yes, I entered right in during the scariness of COVID, and I think that's part of my purpose too, was to be here at this time. So, day to day, not thinking too far down the road, and just doing the best we can to protect each other and our patients.
Okay. So we've spoken with others before here in the past, and if you got maybe not feeling the best or something's not quite right, just come see you guys.
Correct.
Right?
Yep. So we would say, if you're worried about COVID or influenza or those other seasonal illnesses, certainly come in. And if you make criteria for testing, we'll test you. Otherwise, being smart about staying home if you're ill, wearing a mask, socially distancing, good hand sanitizing, those sorts of common things is what we try to hit on too, as far as advice to patients and their families. But yes, don't delay care. If you're having difficulty and we're not open in the walk-in clinic, we always remind them the emergency room staff is always available. So we don't want them to delay care because of the time of day or because they're not sure if they should come in or not. So we do try to educate quite a bit while we're in there, both with handouts but also just verbally with them, so that they know, what do I watch out for now that I'm COVID positive? What are my warning signs for something bigger going on? We definitely educate them on what to watch for a concerning sign.